Hello, and thank you for viewing this recorded presentation at the 2026 meeting of the International Society for Data Science and Analytics. My name is Tafirenyika Shoniwa, and I'm currently a graduate student at Clark University, School of Professional Studies. And my research is titled A Multi-Source AI Risk Analytics Framework for Early Disease Signal and Detection. So the central idea is actually quite simple. Important health risk and signals may begin appearing across several different data sources before a confirmed clinical event becomes visible. So my research asks whether we can combine those weak signals, track how they change over time, and also account for uncertainties and generate an interpretable early risk signal. So I call this proposed methodology a mosaic dry. So one important distinction before I begin, this is an ongoing research stage framework. It is not a diagnostic system, and the results I'll show today are kind of synthetic proof of concept result rather than a clinical findings. So I'll begin with the problem that motivated the research. So when I submitted this research to International Society for Data Science and Analytics, the proposal focused on 5 ideas: multi-source data, temporal risk modeling, uncertain interpretability, and responsible governance. So since that submission, I have been working on making the proposal more mathematically testable. So instead of stopping in an architecture diagram and saying AI will combine these sources, I wanted to answer more difficult questions. For example, what exactly should the risk score be, and how should different sources contribute to it? So this is that led to mosaic dry. So today I'm preserving the research question that was accepted, but I'm sharpening the methodology by defining the score, its uncertain mechanism, its alert logic, and how I intend to evaluate it. So I'm going to look into the problem itself in detail. I'm going to explain the problem in detail. So I would say, imagine that something is beginning to change psychologically. The first signal may not be clear symptom, maybe sleep becomes slightly abnormal, and maybe activity decreases, maybe racing heart rate shifts away from a person normal baseline. And I think all of us, we know that when something is happening in your body, before the disease is diagnosed or detected, there are certain patterns which happens in everybody before that. At the same time, perhaps environmental conditions change or disease activity begins increasing in surrounding populations. And individually, none of these observations proves anything. But I would say, but collectively, and especially when they begin moving in the same direction, and over time, they may contain information that reactive system does not see yet. And somehow I would say it's true. So traditional health system often observe the event later when the symptom becomes obvious. Someone seek care, testing occurs, and confirmed events enters and record those events. So my research focuses on analytical space before that point, because my major focus is to detect before that major diagnosis happens at the clinic or at the hospital. So now the question now is not whether these signals diagnose disease. They do not. The question is whether the convergence gives us easier evidence that risk changing. So now, all this now it leads to 4 limitations I see in conventional prediction pipelines. So, so now the question now, why ordinary prediction is not enough? So there are 4 methodological problems I want this framework to address. So the first, it is a single source blindness. One source may simply not contain enough information. The second one, static thresholds. A heart rate that looks normal at the population level may be very unusual at a particular individual. So the third one is data quality neglect. A measurement collected 5 minutes ago should not necessarily have some influence as an outdated or partially missing source. Then the fourth one is overconfidence alerts. So I would say uh, a model can produce a high probability even when the underlying evidence is uncertain. So, so this research is not about adding more AI to the sake of complexity. I'm trying to design a scoring mechanism that understands which evidence is available, how trustworthy it is, how quick it can, how quick it is changing, whether the sources agrees, and how certain the final estimate is. So in other words, more data should not automatically mean more confidence. So that gives us a very specific research question now. So the research question, my primary research question is, can an observability weighted, temporally sensitive, uncertain, gated multi-source risk index identify emerging signals earlier than the strongest single source model while maintaining calibration and controlling false alerts? So there are 3 things hidden inside that question. The first, I care about earlier detection, so lead time matters. The second one, I care about whether the score is trustworthy, so calibration and uncertainty matter. Then the third one, I care about whether the system becomes noise, so false alert burden matters. This is important because a model could achieve a strong AU or OC and still be operationally poor if it's continuously produce unnecessary alerts. So now we realize that my hypothesis therefore tests not only predictive performance, but a robust to missingness and whether the uncertainty-based alerting reduces unstable warnings. So the test, so to the test, to test that question, the framework begins with 4 classes of data. So now we'll be looking at 4 data sources. So I deliberately kept the 4 source groups consistent with my accepted abstract. The first, personal data. For example, self-reported symptoms or psychological deviations. The second one, behavioral data, sleep, activity, movement, or mobility changes. The third, environmental context, such as air quality, temperature, humidity, or similar exposures. And for example, if you look at this environmental context, I think we have seen here in the United States, people were also affected with the smoke which was coming from wildfires in Canada. In that period, we could see that all those people with respiratory issues were really in a difficult situation. So that's why environmental context also are very important to consider on this research. So, and the fourth one is the public health context. For example, the influenza like illness trends or syndromic surveillance indicators. These sources do not operate at the same level. Yes. If we look in personal and behavioral signals describe the individual, environmental data describe the exposure, public health data describe the surrounding population context. So that difference is useful because independent sources may provide complementary evidence. So now I'll need to emphasize on credibility. For this presentation, I'm not using identifiable patient data. The proof of concept evaluation is synthetic. For the next stage of the research, my intention is to use verified and authorized sources such as CDC surveillance data, EPI, environmental data, etc. So now the question has then become how do we combine for every different types of evidence? So that now uh, intro. So that's when I introduce the proposed methodological contribution, the mosaic dry. This is where mosaic dry comes in. So mosaic dry stands for multi-source, observability weighted, sequential, agreement aware, interpretable, and calibrated. So dry or DRI refers to the disease risk index. The method is 5 major steps. So the first one, normalize each signal against an appropriate baseline. Second, let each source generate its own calibrated evidence. The third one, determine how trustworthy each source it is that on that particular moment. Then the fourth one, fuse not only the evidence level but also its velocity, acceleration, and agreement across sources. Finally, generate an alert only when uncertainty and persistence criteria are satisfied. So, conceptually, Mosaic asks 5 questions. Is something unusual? Which sources are seeing it? Can I trust these sources? Is the signal getting stronger? And I'm confident enough to raise an alert. So these are 5 questions. So let me now show how those ideas fit into the complete architecture. So the architecture moves from raw signals to auditable risk output. So as you can see, we have raw signals, quality filter, temporal alignment, mosaic engine, and risk output. So I would say a risk source without a providence is difficult to trust. The first mathematical step is therefore establishing the correct baseline. So now we look at baseline normalization signals. So this question looks more complicated than idea behind it. The idea is simply this. Instead of asking whether today's measurement is abnormal compared with everyone else, ask whether it is abnormal compared with this individual recent normal state. I use a robust baseline based on the median and median absolute deviation. So why robust statistics? Because wearable and behavioral data can contain spikes, sensor errors, and extremely values that can distort an ordinary mean and standard deviation. So suppose someone heart rate is 78. At a population level, 78 may look completely normal. But if the person's usual resting rate has been around 58 for the previous month, 78 could present meaningful deviation. So mosaic therefore begins with deviation from baseline rather than raw value alone. Once those signals are normalized, each source is allowed to form its own opinion. So now we look at source-specific calibrated evidence. So I deliberately do not force every source through exactly the same model. A behavioral time series and public health surveillance series have different statistical properties. So each source has its own model presented. That model could be relatively simple, for example, a logistic regression, or it could be a tree-based temporal model. The important requirement is that it's probability calibrated before the fusion. So then I transform that probability into log odds evidence. The reason for mathematical, all right, sorry about that. So the reason for this mathematical log odds can be combined addictively and retrain a directional meaning. Each reason This modular design also makes the framework extensible. If a better environment model is developed later, I can replace only that one source model rather than to redesign the entire framework. But before combining those sources, opinions, um, the Mosaic asked another question: how trustworthy is each opinion right now? That's when we need to look into observability weighting. So this is one of the core ideas of Mosaic. Every source receives a dynamic quality score based on three things: availability, do I actually have enough data? Reliability, do I trust the measurement and its provenance? Freshness, is that information still relevant now? I multiply those three values to create a source quality score and then normalize scores into Ys. So now imagine wearable data have been missing for most of the day. So a normal fusion system might still rely heavily on last value it received. So the concept of mosaic reduces that source influence. Or imagine the public health data are 2 weeks old, while current behavioral information is available today. So again, the weights should reflect that difference. So mosaic concept does not permanently ask which source is most important. It asks which source is trustworthy right now. Once the sources are weighted, can be modeled not only the current risk level, but the way that risk is moving. So that's when now we'll see the issue of fused evidence, momentum, and agreement. This is the core mosaic question. There are four ideas I want to take from it. First is fused evidence, the weight combination of the different source signals. Second is velocity, how much that combined evidence changed from the previous period. Then the third one is acceleration, whether the rate of change, and fourth agreement, whether the growth sources are telling a consistent story. So imagine two people, both have risk score of 55. For the first person, the score has been around 55 for 2 weeks. For the second person, it moved from 20 to 35 it moved from 20 to 35 to 55 over the 3 consecutive periods, while multiple sources began agreeing. Those situations should not necessarily be treated as equivalent. So the mosaic concept now therefore models both level and trajectory. I also include a signage term so that agreement amongst the several positive risk sources can contribute more than agreement among several low risk sources. The coefficients are estimated from the development data. They are not manually chosen. So then the coefficients are estimated from development data. They are not manually chosen, as I said before. So now, after the calculation, however, a high score should not automatically create an alert. So so now we look at uncertainty gated alerting. This is where uncertainty becomes operational. So most prediction systems focus on point estimates, but using the mosaic concept, consider the uncertain interval around that estimate. So suppose the score is 75, but the uncertain range is extremely wide. That tells us the model itself is not very certain. Under the proposed alert mechanism, the low uncertain bound must remain above the validated threshold. So the signal must also persist across multiple time windows. At least the two sources must be active, and the overall data quality must be sufficient. So one noise spike from 1 week source does not become an alert simply because the model produced a large number. So the synthetic trajectory on this slide illustrates that principle. Notice that a score can rise before the alert. The condition is actually satisfied. That delay is deliberate. The framework trades what we call a small of sensitivity for a greater confidence and a lower false alert burden. So to evaluate whether these design choices actually help, I begin with the controlled simulation. So because this is an ongoing methodological study, the first evaluation stage uses simulation. Simulation is useful because I know exactly when the underlying latent risk process begins and exactly which signals contain information. In the current proof of control design, a synthetic individual are observed across time, and different source groups begin responding at different points relative to a reference event. So if you look at a public health context, can begin changing earlier. Environmental signal may follow, behavioral changes may appear later, personal indicators may become strongest closest to the event. These things are simulated assumptions, not a biological claim. And I then deliberately inject noise, missing values, different escalation speeds, and unequal source quality. So, so this allows me to ask another question. Does mosaic concept still behave appropriately when the data are imperfect? And okay, so now we have then to ask that importantly, I do not compare mosaic only against the weak models. That now leads us to comparator models. So I would say a new method is only meaningful if it is compared fairly. So I created a comparator ladder. At the simplest level is a personal only model. Then compare against whichever individual source performs the best. So as you can see on this slide, so now novelty should survive a comparison, not just a description. So the initial synthetic benchmark provides a first look at whether what is happening. So as you can see, the synthetic proof of concept benchmark. So we are saying these are preliminary synthetic proof of concept. So I want to be extremely clear about this distinction. They tell us how the method behaves under a controlled data generating process. They do not establish clinical performance. So what I'm looking for here is whether the mosaic dominates every model on every individual metric. And I'm looking for the balance across several objectives, which are discrimination, uh, calibration, lead time, and false alert behavior. The preliminary pattern suggests that the additional mosaic structure is promising enough to justify the next stage of validation. So the appropriate conclusion on this is that at this point, I would say the mosaic works clinically. So one would ask to say, is it? So the methodological behavior is promising under simulation and now requires authorized retrospective validation. So two particular areas need additional asynchronous calibration and robustness to missing data. So now we check the liability checks, the issue of calibration and missingness stress test. So if a model says 80%, but events okay only at 30% of the time amongst cases receiving that prediction, then the model is poorly calibrated. The calibration checks whether predicted risk corresponds to observed event frequency in the synthetic experiment. Then secondly, then I'll look at test deliverance, increasing missingness. This is particularly important for this framework or for my framework because observability weighting is supposed to protect the system when the information disappears. So I want to know how quick each model's performance deteriorates and meaninglessness increases. So ultimately, the mosaic should not only perform well when the source is available, it should degrade gracefully when real-world data becomes incomplete. So the next question now is whether every mosaic component is actually necessary. Um, so now we'll be looking, as you can see on this slide, I'm just going to explain a bit what is being shown on this slide. So, we are saying this is where the research becomes, um, I would say it becomes interesting from the way I see it. So we are saying I can remove quality weighting and ask whether the missing data robust changes. I can remove velocity and accelerate and ask whether the warning lead time changes. I can remove the uncertain, getting and measure whether the false alerts increases. So, and also equally important, I want to document situations in which the framework may fail. So a trustworthy model should tell us not only whether it works, but when we should stop. I mean, and that philosophy also shapes the governance of the framework, which is also very important. So the framework is intentionally non-clinical at this stage. It does not diagnose disease. It does not recommend treatment. It does not perform triage. And it should not be used for patient monitoring without the necessary validation and approvals at the moment. The research data pathway is restricted to synthetic public, properly licensed, identified, and institutionalized approved information. So we look at the issue of fairness also needs to be evaluated explicitly. For example, is the sensitivity different across groups? Does one group receive more false alerts? So does unequal access of wearable create systematic missingness? These are not secondary questions. These are part of the modeling problem itself. So my goal is therefore not to claim that bias has been eliminated. It is to make bias missingness, calibration, uncertainty, and intent use measurable and visible. So that brings me to main contribution of the work. To conclude this research or this presentation, this research introduced mosaic TRI as a proposal framework for combining weak and heterogeneous health-related signals into a interpretable time-dependent and risk index. The method contributes 5 main ideas. The first one is signals are interpreted relative to meaningful baselines. Secondly, source influence stages dynamically according to availability, reliability, and freshness. The third one, the framework models not just the risk level, but velocity and acceleration. Fourth, it considered agreement across multiple sources. And the fifth one, alerts are gated by uncertainty and persistence rather than relying on a point estimate. So the current simulation is a methodological proof of concept, and the next stage is rigorous retrospective and validation using verified and authorized datasets. I mean, such as appropriate CDC and other sources as well. The broader goal is not to create an AI that AI claims to know someone is sick. The goal is to determine whether the changing risk can be recognized earlier, transparently, and with an honest representation of uncertainty. So I would say thank you. I would like to thank the International Society for Data Science and Analytics and the organizing committee and the community for the opportunity to present this paper. So I welcome also the methodological feedback and future collaboration. And thank you. I really appreciate it. Thank you so much.